Did you know that a lot of people use drugs that could damage their kidneys without realizing it? In actuality, your kidneys are critical organs, and your general health depends on their condition. But other drugs, some of which you may be taking today, can harm your kidneys covertly over time, particularly if taken incorrectly or for long periods of time. You may not even be aware that you are endangering your kidneys if you have ever taken antibiotics for an infection or painkillers like ibuprofen. Don't worry though. 5 common medications that can harm your kidneys will be discussed in today's video, along with helpful safety advice. By the time we're done, you'll know exactly what drugs to look out for, how they impact your kidneys, and how to reduce the risk. You won't want to miss this information, so pay attention. But before we get started, I need your assistance with 2 easy tasks. First, please click the like button below if you are concerned about your health and would like to get updates. Although it could appear like a little gesture, it aids in the dissemination of important facts to a larger audience. The second thing you should do is show this movie to someone you care about, because it might truly change their lives. Now, let's get started with the 5 medications that can damage your... Let's begin by discussing the 5 drugs that can harm your kidneys. 1. NSAIDs, or non-steroidal anti-inflammatory drugs. First on our list are NSAIDs, which you have most likely taken for arthritis, headaches, or muscle pains at some point. These consist of typical medications such as aspirin, naproxen, Aleve, and ibuprofen, Advil. NSAIDs are good at lowering pain and inflammation, but if you take them frequently or in excess, they can seriously damage your kidneys. NSAIDs function by inhibiting specific enzymes that generate prostaglandins, which are substances that increase fever, discomfort, and inflammation. But prostaglandins also keep your kidneys' blood flowing. Acute kidney damage may result from your kidneys receiving less blood when their output is inhibited. Chronic kidney disease, CKD, can result from long-term NSAID use, or 2. PPIs, or proton pump inhibitors. Acid reflux and heartburn are frequently treated with proton pump inhibitors, PPIs, such as omeprazole, Prilosec, and lansoprazole, Prevacid. By lowering the quantity of acid produced in your stomach, these drugs relieve painful sensations. On the other hand, prolonged PPI usage has been connected to a higher risk of both acute kidney injury and chronic renal disease. The illness known as acute interstitial nephritis is one way that PPIs can damage the kidneys. This happens when there is inflammation in the gaps between the renal tubules, which impairs kidney function. Unfortunately, PPI-induced kidney injury might have modest symptoms that may not be identified until serious harm has been done. Number 3. Lithium. One well-known drug for bipolar illness and other mental health issues is lithium. For many years, it has been a crucial treatment for mood swings. But over time, lithium can also be harmful to your kidneys. Nephrogenic diabetes insipidus, a disorder where the kidneys lose their capacity to concentrate urine, is linked to long-term lithium use. Excessive thirst and urine production result from this, which may ultimately lead to end-stage renal disease or chronic kidney disease. Regular kidney function testing and making sure you're drinking enough fluids to prevent dehydration are crucial if you're on lithium. You can reduce the dangers and maintain stable mental health by collaborating closely with your healthcare physician. Number 4. Diuretics. Diuretics, sometimes referred to as water pills, are frequently recommended to treat kidney disease, heart failure, or high blood pressure by reducing fluid retention. Spironolactone, hydrochlorothiazide, and furosemide, Lasix, are examples of common diuretics. These drugs can strain the kidneys, even though they are necessary for treating some medical disorders. By boosting urine production, diuretics assist your body in getting rid of extra water and salt. But in the long run, this might cause dehydration, which is bad for your kidneys. Dehydration decreases the amount of blood that reaches your kidneys, and when they don't receive enough blood, kidney cells may die, causing irreversible harm. Electrolyte abnormalities, such as low potassium or sodium levels, can also result from overusing diuretics. Number 5. Antibiotics. Although they are essential for treating bacterial infections, did you realize that antibiotics can also damage your kidneys? Commonly used drugs including vancomycin, ciprofloxacin, and penicillin can have nephrotoxic effects, which means that if used excessively or improperly, they might be harmful to your kidneys. Antibiotics are removed from your bloodstream by the kidneys, but occasionally this procedure might overburden or harm the kidney's fragile tissues. Aminoglycosides, like gentamicin for instance, can build up in the kidneys and directly harm cells. Acute kidney injury, AKI, may result from this over time, particularly in elderly folks or those who already have kidney disease. Always get advice from your doctor before using antibiotics to lower the risk. Understanding these risks empowers you to make informed decisions, safeguarding your kidney health and overall well-being. Prioritize regular checkups and consult healthcare professionals.